My name is Evgenia Zabashtan. I am from Russia, was born in Moscow. I'm working more than 15 years in information technology industry. Definitely, it's not only stress in the body, and it's stress emotionally, because you need to be in schedule, you always meet new people, you take a lot of flights. Definitely, you need to be active in all ways, yes.
It's quite straightforward actually. She has acute disc herniation with severe nerve compression from very big disc herniation. The challenge is that because the disc was very big, it pressed on the nerve badly, so the nerve was like flattened out. And with the surgery, we have to try to minimize the nerve manipulation to avoid the complications of the surgery.
Before the new year, I feel the pain, and a few days it was quite manageable. But one day suddenly it was very bad pain. I could not handle it anymore. And I called to Bumrungrad that I find that Spine Institute in Google in Bumrungrad. Doctor also was very nice, and he was not trying to make me scared what kind of problem is that. And doctor already saw that I had the surgery before, but it's not necessary that something is related. It just was a pain which is completely destroy my life and destroy my plans. So this was the case why I came to Spine Institute in Bumrungrad. Yeah.
What she had before was conventional discectomy. Okay, so the surgeon had to make a big incision, and they have to scrape the muscle out of the bone. And the pain receptor is at the surface of the bone that is connected to the muscle. So usually from this kind of procedure, the patient will have a lot of pain, and usually it takes a few days before they can walk, or maybe a week before they can leave the hospital. With the endoscope surgery, because the wound is very small, it's like the tip of my little finger. The wound is about 5 to 8 millimeters, something like that. And we pass the scope into the patient with the natural corridor of the spine without cutting any muscle. So we can just go directly to where the problem is and just remove it, just like that.
Yeah, when I met Dr. Vitamin, he was quite strict in that particular moment. He said that I don't know your plans, but it is quite urgent. I don't know how you handle that pain, because it is a herniation, and it's a big herniation, and you need to solve it quite fast. So your surgery is in that day, and that's it. I was not afraid. He explained very much in details what kind of surgery is that, what it is about, what to do. So I didn't feel any stress. I knew that it really helped me. So I didn't argue. Yes, it is like that. Need to do that.
We have all kinds of specialists needed to treat the spine patient. We have also spine surgeons, we have physical therapy doctor, we have also pain specialists to help treating the patients together. Most of the cases of spinal problems, we do not need surgery, only about 10 to 20% of them only. So the patients do not have to afraid that if you come to see the doctor at the Spine Institute, that they're gonna need to go through surgery. But most of the time, we do it without any surgery.
I want to say thank you very much to Dr. Vitvin for helping me with my problem, and it was so fast reaction from his side on the pain which I was feeling, and everything was organized very well. And I also want to thank to all team of the Spine Institute. They were very much paying a lot of attention to my problem, and they understand everything and try to fix the schedule time about different research to do it in time. So actually the whole story was happening so fast that I didn't suffer so much of my pain. So I'm very much thankful to all team and Dr. Vitvin.